Okay. Hey everyone, it's Courtney Reyes, Executive Director with One Iowa. My pronouns are she, her, hers, and I'm so excited to be talking with One Iowa board member, overall badass lady, Dr. Katie Imborek, and she's going to be telling us about some COVID things. It's hot on our minds. I don't know, I read so many articles, Katie. I'm excited to be talking with you, an actual human who has some really incredible scientific information. So I'll let you introduce yourself, tell us about what you do and what we need to know about COVID.
Oh, thanks so much, Courtney. I'm really honored to be here as well. My name is Katie Imborek. Pronouns are she, her, and hers. I'm a family medicine physician at the University of Iowa Hospitals and Clinics. I have a couple of different roles there. I'm the co-director of the University of Iowa LGBTQ clinic. I'm the medical director for offsite primary care, which includes our walk-in locations, quick care and urgent care, and kind of as through that, and trying to kind of be prepared for COVID coming, that was how I found myself as the medical director of our influenza-like illness, or ILI is what we refer to it as, which is essentially kind of our COVID response at the University of Iowa. So this is really sort of thinking about how do we handle people that are not yet hospitalized, but may have symptoms of COVID, which may or may not be the coronavirus, as we all know. How do we get them into our system via telemedicine? And then how do we go about getting them a test and the appropriate follow-up that they need?
Yes. Oh, I love that. So if I recall, you were one of the first ones to help get telemedicine started for this COVID response. Is that right?
Yeah, so this was back in March when the coronavirus had just sort of made its way to Washington State, and I'm sure across the country, healthcare systems were really scrambling and thinking about how are we going to deal with this. And very quickly, my team knew that telemedicine, which was something that we had really just dabbled in, but we knew that this really could be the mainstay of how we evaluate and treat patients with an infectious disease. So not only to keep our own work staff safe and healthy, but also to keep our other patients in the community safe and healthy. There's no better place to do it than from the safety of your own home.
Yeah, absolutely. And I know as we think about LGBTQ healthcare, it makes me excited that telehealth medicine is going to be something that is more natural for folks. And that seems like a way that we can get a lot of people in areas that don't have access to LGBTQ providers, really incredible healthcare as we systematically train folks throughout the state. So I am super excited that y'all have been pushing that forward because I think it's going to be great for LGBTQ folks.
I'm totally with you. I feel like when I am at my best and most optimistic, I can think of the silver linings of the pandemic. And with regard to healthcare, I think telemedicine is for sure at the top of my list. So we have been seeing patients via video visits and as well as just some regular old phone calls since March in our ILI or influenza-like illness coronavirus clinic, but we've also been doing that across our other service lines. So for instance, with many of my LGBTQ patients, my transgender, non-binary folks, a lot of them do come from hours away from Iowa City. And so it's been a really great transition to be able to see them via telemedicine. And I'm excited to continue that well into the future.
For sure. There's just so many barriers to good quality healthcare and driving and having a reliable car. That's not something we need folks to be worrying about.
Absolutely.
I'm so excited. Okay, well, we had some folks put in some questions, but what would you say, I think as just a human being, like what is your maybe top 3 tidbits you would give us of what do we need to know about COVID right now in September? What are we, 6-7 months in now?
Yeah, so that's a great question. And I think that you could do this in so many different directions. So, I mean, I think that that where I'll probably tackle it from is really more so just sort of what do we need to know about the coronavirus and this pandemic that we have found ourselves in. And I think that the most important thing to understand is that this is a viral illness, and it is very similar to something like influenza. However, there are real clear and distinct differences. So while the symptoms can be virtually indistinguishable, which means that you can have fever, headache, body aches, cough, kind of those cold symptoms that are really typical of influenza. You can also have some other symptoms that aren't necessarily associated with the flu. And that'd be sort of those loss of taste, loss of smell, sometimes some GI things like diarrhea. And those are really more specific to something like the coronavirus. And
Okay.
so while the symptoms are similar, we do know that COVID does tend to cause much more problems in terms of mortality or morbidity, so risk of death or risk of serious complication. And that can change as we look at the different populations. So the older that someone is, or the more underlying medical conditions that they have, the more worrisome that something like coronavirus is for them. But it is definitely more dangerous than influenza. We've had more people hospitalized, we've had more people die, and we potentially might see more long-term consequences, which we're just starting to learn about with COVID as compared to influenza. So while they're both respiratory viruses and they have a lot of similarities, I think that that it is worrisome to me if people just start to treat this like, oh, it's the flu, I've had the flu, I got over it, it's no big deal. If you are a young and healthy person, it is highly likely that you're going to get over COVID without any problems. But it's also really likely that you will give it to at least one other person, who will give it to at least one other person. And at the end of that line, it might be someone who won't be so lucky because they aren't young and healthy, and they may end up with a significant illness.
Yeah, I love that you talked about that, because I think there's such this myth that, like, you know, all of the college kids in Iowa City or in these different towns, or kids going back to school, like a lot of people are feeling really stressed about what's right, but knowing that it may not be you that's greatly impacted. It's the folks that you may come in contact with by just going to the grocery store asymptomatic, like, I don't know that I'm sick. Would you say that that's true, that I could be doing my weekly grocery shopping and I don't show any symptoms, but I could have COVID?
It is absolutely true, and it's one of the ways that that this illness has been really hard to contain. Clearly, is when you have something that is quite infectious, and so we know that there's this number sort of called, so what it's called is R naught, or R with a little zero, and that number is kind of the mathematical factor of infectivity. So how infectious that something is. And the R naught for something like COVID tends to be different when you look at different communities. But if it's more than one, then that means that for every person that has the infection, they're giving it to at least one other person. And that's usually where it's been hovering for the last couple of weeks in the state of Iowa. And when you have something that you don't even know that you are infectious at that point in time, then the potential for you giving it to someone else is only greater than it would otherwise be. So there's some estimates that say that maybe as high as 30% of infections, of people who are infected with COVID don't have symptoms and they don't know that they're infectious. So it makes it really risky in terms of kind of using something like, do you feel sick or well? Okay, you don't feel bad, come on over and let's kind of be in a situation where we could be exposed to each other. And that goes out of the window 3 out of 10 times. So with regards to the grocery store and with regards to this in general, the way that we absolutely know that we can decrease the risk of asymptomatic spread is if everyone wore a face covering. So that is super important. You'll hear all of our public health folks and our epidemiologists talk about it. And if there was one thing that we could really do that would make a difference, it would be to mask up. And so thinking about, you know, what are these things that make us high risk exposed? And it's face coverings, and it's social distancing, and it's also exposure time. And thinking about how those 3 variables kind of come into play, that you can keep yourself safe, or that you can know that you've put yourself in a situation where you would potentially be high risk exposed.
That's great. I love all of those tips, and so important to wear a mask. I'm going to put a plug in. We have free masks from One Iowa. We signed up There were so many free resources where we could get them, and we have 5 packs. They're lined with something that helps keep even more bacteria out, and then they're reusable up to 15 times. So that's 5 masks, 15 times each. It's a
Right.
really great way to keep yourself safe. And so all you have to do is go to our website, and we can get you one of those masks. We'll drop them into the mail for you, free shipping. We just want folks to mask up and protect themselves and protect others.
That's right. That is great. Um, I often, wish that we were in a place where masks were mandated. I think that you'll talk to folks who might have, been traveling or on vacation or have family elsewhere, where wearing a mask is just really commonplace. And especially in some of these states where they've been doing it for a long time. And it's just no big deal. You have multiple masks, they're different colors, you use them as accessories to your outfit. And I think we here in Iowa, it's still in where it's not mandated, there still is just that hesitancy. And I think that there's also some of that fear because you feel like you're really just not as safe as you otherwise would be. I think the data plays out. You look at the different states, and clearly those that have put interventions into place have done a little bit better with regards to, current and recent infection rates. But wearing a mask is the most important thing that you can do to protect others and hope that they wear a mask to protect you.
Yeah.
That is a mainstay of how we're going to get through this.
I love that. I always try to channel my 9-year-old. He thinks it as just as an accessory, like he turns into a superhero when he puts it on. And I'm like, buddy, we're in the car. We don't need it on yet. And he's like, no, it's good. We got it. He's like ready to go. So if I could get everybody to be that excited about a mask, then we would be in maybe a better spot. So a lot of folks are concerned about or want to know why LGBTQ folks are more at risk for getting COVID-19.
That's a great question. And the answer to it is really that it's the same reason that other marginalized communities are at greater risk, not only of contracting it, but of having complications from it. And so a lot of these reasons just have to do with, like, one, what are LGBTQ people doing in our society and what place do they play in our workplaces, or what position do they hold in our workplaces? And so for a lot of our LGBTQ folks, they may be sort of some of those frontline essential workers, some of our food service people working in places like ag or in some more kind of customer service or people facing positions where they don't have the option to stay at home and work remotely. And so that just means that you are inherently more likely to come in contact with the coronavirus, as you are more likely to come in contact with more people.
Yeah.
The other part that has to really, that you have to remember with regard to complications, so complications like hospitalizations or long-term, problems, and even things like death, is that the more underlying health conditions that you have, the more likely you are to have a significant and potentially complicated course with COVID. And for LGBTQ people, we know that these are some of the folks who might not have the same access to healthcare as non-LGBTQ counterparts do. And some of that may be tied to things like discrimination in employment, because all of our, or most of our health insurance options are tied to our employer. And if we're under or uninsured, we know that we just don't access healthcare quite as much. And that leads to a whole bunch of long-term consequences, a whole bunch of increased chronic health conditions. And similarly, LGBTQ people, even if they do have health insurance, sometimes you just don't feel that same comfort and you don't feel that same level of respect or affirmation accessing healthcare. And for that, we know for a fact that LGBTQ people may not access healthcare as much as non-LGBTQ counterparts, just out of fear of discrimination. And that, in the same type of way, can lead not only to acute complications and something like if they have an infection and they're afraid to seek care, or long-term things with regards to diabetes or COPD or asthma or whatever that it might be. So those are just a couple of the ways that something like COVID, although we don't have a lot of good data on it, right? So we don't know unless we actually ask the question, and we we don't do a great job as a health system of actually asking that question from a demographic standpoint. Who are our LGBTQ patients?
Right.
But we would just have to believe that, similar to how we know that this virus has disproportionately affected our Black and brown folks, that it would do the same for other marginalized populations like LGBTQ people.
For sure. And then just so many, like, you just don't want to go to the doctor when you haven't had a good experience there, and why it's so
Right.
important that we have to keep pushing for inclusive healthcare providers all over our state, just not in our little big cities here that we have. We need it everywhere. So that's a
Absolutely.
good reminder. Let's see what else we have from folks. We love that people messaged us or filled out our form to submit some questions. So I'm just going to read this next one to you. I have two parents who are in a high risk category, diabetic and 60 plus, and they wear masks when we are out, but I still worry about them. What is the risk for them as we see continued spikes of COVID-19 around Iowa? What are some things folks can do that are in these at-risk categories? Maybe they should or shouldn't be doing. How can we help keep those folks safe?
So that's a great question. And I think that we're going to touch upon some of the things that we've already talked about. And so one is wearing a face covering or a mask. And although we really think about how wearing, I wear my mask to protect you, you wear your mask to protect me, there may actually be some small benefit for the person wearing that mask or face covering. So, I think that there's still some to be learned there, but masks are super important. And so the flip side of that is trying to go to a place that does mandate masks.
Yeah.
So find a grocery store or a store or wherever that you might be going where masks are mandated so that you can feel safe, that you're going to enter into a situation where those around you are taking the steps needed to protect you. Many grocery stores sort of have specific times, or maybe it's the first thing in the morning where they reserve that for folks who may be higher risk. That would be great. But I think that if you are truly in a high risk category, that you need to make decisions just based on how much risk do you want to assume.
Yes.
And there's some really great graphics out there. And I think that it is super overwhelming if the message is lock yourself in your house and don't leave until we tell you when, and maybe it's going to be in who knows how long, right? Like, I think that that's when we as humans just sort of throw the towel in and say, like, forget it. Like, this is crazy. We can't do it. And I love something more like, like a Weight Watchers approach, right? Like, maybe we have like this many allotment of sort of risk for the week, and we can make decisions where we can kind of say, like, all right, I did this, which was a little bit riskier. Like, I went to the grocery store as opposed to just have my groceries delivered. But because I did that, then I'm going to make this other choice here because I want to sort of maintain kind of this baseline low risk. Or I'm going to make the decision to maybe go over to my family member's house for a birthday party, knowing that it's outdoors and we're all going to be 6 feet apart and spaced out. But because of that, because I did interact with some folks where I don't know what they're necessarily, rules of their own life are, but I'm going to maybe do something a little bit safer that I would maybe not have done the week before, or something like that. So it's really just kind of looking at it not as an absolute thing, but just what are the different decisions I can make every day. So a couple things that I love. Outdoors is way safer than indoors.
Yes.
For sure. We live in Iowa. We cannot go outdoors for much longer, but right now, take advantage of it. If you want to go out to eat somewhere, please do it outside. I think that being indoors and taking your mask off with people that have their masks off, and hopefully they're having a great time and laughing and talking loudly, that puts you at really high risk of potentially coming into some coronavirus particles. Okay. Outdoors, good ventilation, those virus particles are gone. And you don't have that same risk of inhaling it to the extent that you would need to get infected. So outdoors is better than indoors. Wearing a mask, wearing face shields, and then really just trying to make those decisions for what are the things that I can do where I can maybe stay 6 feet or more from someone. So if you are outdoors more than 6 feet, you can take your mask off. That's okay. All right. But if you get indoors or if you get less than 6 feet, then you should put your mask on, because that social or physical distance actually does come into play as well.
Sense. And that's why face shields are also a good option. We don't talk about them as much. Like, people are, I feel like, embarrassed to wear a mask. So then the idea of wearing a face shield seems even more embarrassing, but also a good option if that's something maybe you can't, it's really bothersome to have something on your face.
Yes.
Is a face shield still a good option for those folks?
That's a great question. And there's been a little bit of controversy out there with face shields. The University of Iowa hospitals and clinics, we were one of the first places to start wearing shields. And I think that there's some really great theory behind it. So one thing is, we talked a lot in the very beginning, like, don't touch your face, and we all sort of thought like, gosh, who knew I touched my face this much? So you have a face shield, you physically can't touch your face. I mean, it's really helpful. But I like shields sort of in combination with a mask. Shields protect your eyes, and anywhere, eyes, nose, or mouth, if that coronavirus, if those particles enter your body through there, you could potentially become infected. So it does protect your eyes, which is great. And if you aren't able to wear a mask, especially if you might have baseline breathing problems, a face shield by itself is the best thing for you. So if it's the option of nothing or a face shield, please wear a face shield. I would say that probably the way that most recommendations are falling is that masks may be better than face shields. So at the university, we tend to wear both of them. Yeah. And, when I've been talking to some of my 2 kids, we've bought some nice shields for them, which they might end up wearing should they go back to school in person, but they would wear a mask in addition.
Yeah. Oh, that's great to know. And also good to know that, everyone has a different body, right? And people's bodies respond differently to things. So good to know that there's a little bit of an option there. Gender woman, she writes that she desires bottom surgery and have heard several different and conflicting informations regarding whether UIHC is doing gender confirmation surgery. Can you speak a little more to that?
Yeah, absolutely. So the University of Iowa hospitals and clinics, in alignment with the governor's proclamation back in March and April to stop doing non-essential surgeries, we had really stopped a lot of our surgeries, and that volume has picked all the way back up. So we are now doing many procedures every day, sort of in a very pre-COVID type of volume. So all of our patients who are going to have a surgical procedure, or many of the surgical procedures at the university, if it's planned, we do COVID testing prior to the procedure to ensure that they're negative, and that is mainly for the safety of our staff that's going to be caring for them. And so we are absolutely doing male chest reconstruction. We're doing vaginoplasties, vulvoplasties, the whole 9 yards. So that is operating as we have done in a pre-COVID era, and we will continue to do so unless there's some sort of an outbreak in the state or in our region where we need to where our administration would make some of those decisions around surgical procedures should we need to shift our resources.
Yeah, no, that makes a lot of sense. Thank you so much for that. Definitely helping put some folks' minds at ease. Here's a good one. I also have the same kind of thought process. In March, everything was so scary and we didn't know what was happening. And it was this kind of just really frightening time for so many folks. But are we better? Are we worse? Are we in the same spot? Like, we feel like we've been doing this for a long time. We feel, someone else mentioned, like, I feel like people are over it. And I'm sitting in my house still, like, trying to do the right thing and protect myself and protect my family and protect others. Like, where are we at? What's happening? What would you be your report?
Yeah. I think it's understandable to have like COVID fatigue, right? Like, you're just sort of like, I felt like I've been really good at this, and now I feel like, maybe it was overblown, maybe we're past it. Where are we? When you look at a lot of the data, that sort of will trend back to when it all started in March. We had a little bit of an uptick there, kind of as a state and certainly as a region around Iowa City, in late June, July time, and then it flattened out again. And then we've had a recent spike with the return of college students. And we can see that, in many college towns, really across the whole nation. And that spike has been trending downward some, but still, if you compare some of our numbers today as to the numbers back in kind of March, April, we definitely have many more cases per day and kind of per capita than we had been having initially. So we are in no ways out of the woods or over this yet. I don't feel like we're really going to get to that point where we get to say COVID is in our rear view mirror until we get a vaccine. So we need to get to a point where we have herd immunity. So that means that if we think of sort of all of society as a herd, and where there is not as much risk of coming into contact with someone who has COVID, we need to really make sure that, and the numbers differ, and it might be 60 to 70% are some of the latest numbers that some of the epidemiologists might throw out, but 60 to 70% of the population that is immune to the coronavirus. And there's two ways that can happen. And one is that you have natural immunity from COVID, from an infection. And I don't know that we're really sure how long that natural immunity will last for. The CDC has recommended that we don't retest people within 90 days. So I think that means that we're fairly certain that you have immunity for 90 days, so for 3 months. And the other way to become immune is, of course, to be vaccinated.
Right.
And so we are putting a lot, we're really betting, and I think rightfully so, that we're going to have a vaccine that will afford immunity to those that are vaccinated, and hopefully for a number of months. And maybe it's going to be a seasonal shot like influenza. Right. That it will not be 100% effective because no vaccine ever is. Right. But we have to hope that we have some sort of effectiveness that, combined with how long that we can get that immunity, that we can get to the point where we can safely kind of lead some of our pre-COVID lives.
Okay, that makes a lot of sense. I really appreciate that. And that goes to this next question about, can I get COVID multiple times? And how does that work? Is that
Yeah. So there have been for sure some cases, not only I think that there's been a couple that have been published in Japan and some of those countries, but also most recently there's been a number of case reports from the United States where people have had COVID twice. So they have had an infection, they have cleared that infection, they have felt better, they've been exposed again to somebody with the virus, and they have become reinfected. And again, most of those are happening outside of this 90-day window. So that's where some of the recommendations come in. And this is the guidance that we give to our providers who are really on the front line, seeing 400 to 500 patients per day via telemedicine, is if they have had a lab confirmed COVID case within the last 90 days, it is highly unlikely that they have the coronavirus right now. So how that can happen is because, it's sort of just like the flu, where you have to get your flu shot every year because the immunity that you get from it just wanes. And so we think that it's probably something similar, where you get COVID and your body builds up antibodies to protect you, and those might just wane. And then if you are exposed to it again, you could become reinfected.
Yeah, that makes a lot of sense. And I think is a good reminder to folks is that this is so new, like where we've been studying the flu for how long, or influenza for so long, and that's how we have a vaccine. But this, we don't know the consequences it has on us because it's just started recently for us in the terms of studying medicine, it seems.
Completely. Yeah.
Oh, well, I think I've wrapped all of my questions. Do you have any last, if you were going to give us the 90-second, 60-second pitch of like what you should be doing, I would love to hear that, because we'd love to have it as a closer.
Yeah. So I think that it is really important to remember a few key things to keep yourself safe. Wear a face covering,
Mm-hmm.
wash your hands,
Yes.
and keep physical distance from people. So more than 6 feet away. And if we can do those 3 things as a society, I think it can make a big difference for how our rates are. And our rates really tie into who gets hospitalized and who potentially dies from this virus.
No, I love that. I love those 3 key takeaways. And what I really heard you say is that it may not always be about you. Like, you're protecting other people by wearing a face covering. You're protecting someone like where you may not get sick and possibly die, but you could come in contact, and you would hate to be that person that kept that virus going.
Totally. Yep. You got it. I mean, I think that that wearing a mask should be something that speaks to our common humanity.
Yeah.
Right.
We're all humans trying to do our
Yes.
best, right?
Yes. We are in this together, and it takes a team of us only working together to be able to get out of this as quickly as we can with the least amount of economic and or, real life impact.
Yeah, for sure. Well, Katie, thank you so much for joining me. It was a pleasure to wrap my day with you. Please let us know if new things develop. Always know that you should put us on your list of folks to call, because we'll get the word out for you.
That's great, Courtney. Thanks so much.
All right. Thanks, Katie.
Thanks for having me. Take care. Stay safe.
You too.